A lot of the questions that I get asked around federal advocacy have to do with why is AANP trying to get us into Medicare? It's a broken system. They don't pay well. It's full of paperwork and bureaucracy. Why would we want to get into Medicare? So the number one reason that we advocate for inclusion in Medicare is it is part of our strategic plan, which I put here as goal number 2, which is to achieve full scope legal recognition of the naturopathic profession throughout the United States at the state level, local level, federal level. We want you to be able to practice to the full extent of how you are educated and trained, and to be compensated and reimbursed for that. So that's just kind of what it is for us. But these are the other reasons that it's important to be recognized by Medicare. Jobs is a big one of them. For the majority of healthcare jobs, you need to be covered by insurance of some kind, and preferably all kinds, for clinics to be able to hire you. There are some communities, especially rural communities, that they are 50 to 75% of their population are seniors who are on Medicare. And so for those clinics to be profitable, viable businesses, it's not really realistic that all of that 50 to 75% of the population is going to be paying cash for services. So for the clinic to even have the funding to be able to hire you, you need to be eligible for Medicare. So it just opens up jobs. Certain healthcare savings accounts or flexible savings accounts, which is where a patient or a person puts their own money into a special account, and it is usually pre-tax dollars. So there's a tax benefit to that, and it's then dedicated for healthcare. Some of those specially designated healthcare savings accounts stipulate that the only time that you can withdraw your money is if you've had services done specifically by an MD or DO. So even if you're putting your own money aside and you want to use your own money for a provider like a naturopathic doctor that you choose, once that money goes into those special health savings accounts, if they're restricted like that the funds can only go to an MD/DO, doesn't matter if it's your money, you won't be able to use it for a naturopathic doctor. We talked earlier that residencies, reason number 3, residencies are primarily funded by Medicare. So if you're not recognized by Medicare, we will continue to have to find private funding for our residencies. And that is the number one reason that we don't have residencies universally available for all graduates. Many loan repayment programs also stipulate that you have to be an MD/DO as defined by the rules in Medicare. So we are not eligible for some of the loan repayment programs that medical doctors are eligible for, just because we're not recognized by Medicare. Even more reasons. So this is not as much the case, but it has been in recent history that there have been many, especially when the rollout of the Affordable Care Act happened, there were a lot of incentivization programs that could only go to MDs and DOs because they were defined in Medicare. So things like converting to your practice to an electronic health records or an electronic medical records system, you got incentive payments if you did that from Medicare. But if you were a naturopathic doctor, you had to cover the cost of that all out of pocket. There was one exception for naturopathic doctors in Oregon, but that's a story for another day. A lot of hospice, home health, convalescent care, they require that you need to be an MD/DO to sign off on orders for those services because MDs and DOs are covered by Medicare. It just levels the playing field. If we could get recognition by Medicare, then it elevates us to being on par with all other primary care providers. So that's just kind of a no-brainer. And another no-brainer is, yes, if we do get recognized by Medicare, we would be able to see seniors. It doesn't mean that you would be forced to get credentialed by Medicare. So if you chose not to, you wouldn't have to get into that broken system that is full of paperwork and bureaucracy and that doesn't pay as well as you hope. But for those NDs who would really like to be more accessible to that senior population, or who have patients who they've seen for 20, 30 years of their lives and they want to provide continuity of care for those patients as they age up into Medicare. It would allow the opportunity for that as well. So those are all my reasons of why getting into Medicare is not just about seeing seniors. The way of naturopathic doctors is to find the root cause. And so the reason that we advocate for inclusion in Medicare is this one definition. So Medicare, it's important to recognize, is actually defined in the Social Security Act of our statutes in federal law. And this one definition in the Social Security Act, which is the Medicare chapter, specifically says the term physician, when used in connection with any, you can read it, specifically means a doctor of medicine or osteopathy, doctor of dental surgery, podiatric medicine, optometry, and a chiropractor. But chiropractors, there's the limitation of only with respect to treatment of manipulation of the spine. So all those other programs that I mentioned, if you can go back, just kind of flash to the last two slides, the incentive programs, the hospices, the residencies, the health savings accounts, those are all their own statutes. But what happens is they all say something like a physician as defined in section 1861 R1 of the Social Security Act is eligible for this loan repayment program, or a physician as defined in section 1861, blah, 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 may order home hospice care. So you have all these other laws out there in the world that all point back to this one definition of physician that is embedded in the Social Security Act with the definitions for Medicare. Medicare is that big that it influences all of these other separate laws. So that's the root cause. And that's why we say we want to be recognized by Medicare, because if we can get naturopathic physician into this definition, it will have a chain reaction of opening up all of these other things.